Hey everyone, it's the Diplomat, and we are on part 40 of the Chris Watts Discovery Read-Through. And in this part, we are going to go through the toxicology and autopsy report for Bella. It's going to be a bit of a tough read, so I just wanted to give everyone fair warning. These are not easy to go through. But first, I just wanted to give an update on Buster. So Buster had his surgery, and I thank you all for supporting my brother and his family and Buster. Just really awesome. And I wanted to make sure I kept you updated. So I have some pictures here that I'm sharing him right before the surgery at the animal hospital and inside the office as well. And then I guess on a doggy stretcher, which I've never seen that before myself. And then we have some post-surgery pictures. So there's Buster with his cast on and also resting. He's going to be about, I guess it was 6 to 8 weeks. So it's going to be a little bit of a recovery. And there he is also a little sad with that big old cone on his head. It's pretty big, so my brother's been trying to take it off of him here and there when he can, but otherwise that has to stay on for his own protection. So I will keep giving you updates. I know my brother has to bring him back soon, but I will continue to update. He's doing well, he's recovering, and I can't wait to see him. I haven't actually seen him yet. Since his surgery, so hopefully I'll get over there very soon and see how Buster's doing. But thank you once again, and I will look to keep you all updated. With that, let's get into this report. So on the first page here, we have the NMS Labs Toxicology Report for Bella. This report was issued on September 12th at 2 p.m., and this was addressed to the Weld County coroner. So it lists the positive findings of the toxicology report, and I will read through the following compounds along with the result listed, and in a few we'll get into the actual definitions as we go through the report. So the following compounds were listed again as positive findings. We have benzene with a result of present, ethylbenzene, result of present, toluene, result of 3.7, xylenes, OM and P, listed as present, hexane, listed as present, methylpentanes, that's 2 and 3 isomers, listed as present, butanol, listed as present, ethanol, listed as a result of 13, and lastly acetaldehyde, which listed as present. Below the compound table it says see detailed findings section for additional information. Testing requested. The first test description is post-mortem, basic, tissue, in parentheses, forensic. The second is hydrocarbon and oxygenated volatiles panel, blood. Tests not performed. Part or all of the requested testing was unable to be performed. Refer to the analysis summary and reporting limits section for details. Specimens received. The first is a gray top tube. Volume is 5 milliliters, collected on August 17th at 3 p.m., and that's the same for all 4 of these. Source is chest cavity blood. The next is red top tube, 0.1 milliliters. This is from the vitreous fluid. 3. Orange plastic container, 25.77 grams, from liver tissue. And 4. Homogenate container, volume not given, from liver tissue. All sample volumes/weights are approximations. Specimens received on August 21st. So again, collected on the 17th at NMS Labs on the 21st. Then detailed findings, it gives a list of all the compounds again. And then under that, it says, other than the above findings, examination of the specimen submitted did not reveal any positive findings of toxicological significance by procedures outlined in the accompanying analysis summary. Reference comments. Acetaldehyde from the chest cavity blood. Acetaldehyde is a flammable, colorless liquid used industrially in many processes, for example, dyes, pharmaceutical and chemical manufacturing. In vivo, it can be found as the result of metabolism of numerous drugs, chemicals, and foods. A primary source for the finding of acetaldehyde in biological specimens is via the metabolism of ethyl alcohol. Other common sources may include paraldehyde, metaldehyde, phenacetin, ethyl esters, and vanilla. Some pathological conditions, for example diabetes, can account for increased acetaldehyde levels in vivo, especially after consumption of alcohol. Alcoholics and individuals taking the aldehyde dehydrogenase inhibitor, disulfiram, in parentheses, antabuse, concurrently with alcohol consumption may have elevated blood levels of acetaldehyde. Normal blood levels of acetaldehyde are probably less than 0.02 milligrams. Adverse effects such as flushing, headache, and shortness of breath may be present at acetaldehyde blood concentrations greater than 0.18 milligrams. Acetaldehyde is an unstable compound post-collection and will both form and degrade under certain sample handling conditions. 2. Benzene from the chest cavity blood. Benzene is a common laboratory and industrial solvent, which is also found in gasoline and paint removers. Benzene concentrations in the blood of environmentally exposed individuals average 0.0002 mcg in non-smokers and 0.0004 to 0.0006 in smokers. The majority of benzene is excreted as phenol. Reported blood concentrations of benzene in fatalities following oral ingestion or inhalation ranged from 0.9 to 120 mcg. 3. Ethanol, or ethyl alcohol, from the chest cavity blood. Ethyl alcohol, in parentheses, ethanol, drinking alcohol, is a central nervous system depressant and can cause effects such as impaired judgment, reduced alertness, and impaired muscular coordination. Ethanol can also be a product of decomposition or degradation of biological samples. 4. Ethylbenzene from the chest cavity blood. Ethylbenzene is used as a commercial solvent, fuel additive, and chemical intermediate in the production of styrene. In the U.S. population, blood concentrations in non-occupationally exposed individuals are generally less than 0.001 mcg. Exposure to this compound generally occurs through the pulmonary route. At air concentrations of 1000 ppm, the compound causes irritation to the eyes and nose. Higher concentrations may result in dizziness and central nervous system depression. 5. Toluene, chest cavity blood. Toluene is an organic solvent commonly found in such products as glues, paints, and lacquers. It is, like benzene, a CNS depressant. Hippuric acid is the glycine conjugate of benzoic acid, an oxidized metabolite of toluene, and is used as a biomarker for toluene exposure. However, hippuric acid is also a normal constituent of urine as a result of metabolism of compounds other than toluene. Another urinary marker for toluene exposure is O-cresol, a substance not normally found in urine. The ACGIH Biological Exposure Index, BEI, for toluene in venous blood prior to last shift of work week is 0.02 mcg. Toluene has been frequently abused for its intoxicating effects by teenagers or adults who inhale the vapors of paints and glue solvents. A report of 136 such persons who were either hospitalized or arrested while intoxicated showed blood concentrations of 0.3 to 30 mcg. Intoxication with toluene is manifested by slurred speech, slow movements, and inability to concentrate. 6. Xylenes, chest cavity blood. Xylene is composed of 3 isomers, O, M, and P xylenes. These compounds are often found as components of solvents, paints, etc. After exposure to xylenes, methylhippuric acid is a urinary end product. Xylenes and related products may be found in fire victims exposed to burning accelerants. Workers exposed to 29 ppm xylene demonstrated end-of-shift blood xylene concentrations averaging 0.38 mcg. 7. Butanol, or butyl alcohol, from the chest cavity blood. Butanol is a flammable liquid used as a solvent for fats, waxes, resins, shellac, and varnish. It is also used in the manufacture of lacquers, rayon, and certain detergents. Exposure by inhalation may result in irritation to the mucous membranes, coughing, difficulty breathing, headache, dizziness, and drowsiness. It can be absorbed through the skin, leading to symptoms resembling oral ingestion. Oral ingestion may result in sedation, abdominal pain, nausea, headache, dizziness, and diarrhea. Large doses may affect the liver and kidneys. The acute toxicity is estimated to be about 3 times that of ethyl alcohol. Sample comments. Physician pathologist name Burson, County Weld. Tissue specimen required homogenization. An NMS Labs generated homogenized tissue sample. Unless alternate arrangements are made by you, the remainder of the submitted specimens will be discarded 1 year from the date of this report, and generated data will be discarded 5 years from the date the analyses were performed. Signed by Eric Flail, BA, Certifying Scientist. Analysis, summary, and reporting limits. All of the following tests were performed for this case. For each test, the compounds listed were included in the scope. The reporting limit listed for each compound represents the lowest concentration of the compound that will be reported as being positive. If the compound is listed as none detected, it is not present above the reporting limit. Please refer to the positive findings section of the report for those compounds that were identified as being present. So again, like the last one, I'm not going to go through all of these compounds, but if you'd like to come back and look at all of the different compounds that were listed and their reporting limits for being considered positive, you can do so. I will say that there were some listed as not reported and canceled due to an interfering substance. So that was for the propanol. And then for the methyl tertiary butyl ether, also canceled due to sample matrix problem. So that's a follow-up from before when they said some of the things were, they had issues testing. Okay, so they went through a number of those compounds. Again, there is a autopsy by body diagram, but I will go directly to the report since all this information is in there, and again, it's a little tough to read. So moving down to page 1017, we have the autopsy report, name of decedent, Bella Watts, date and time of death pronounced is August 16th, 2018 at 5:50 p.m. Again, that is the pronounced date and time of death. Date and time of autopsy, August 17th at 1:30 p.m. Diagnoses. History of being reported missing and subsequently located in an obvious state of death within an oil tank battery. A. asphyxiation due to smothering. B. Blunt force trauma of the frenulum and gingival mucosa of the maxilla. C. Postmortem artifact, in parentheses, decomposition. D. Oil, water, and sludge debris in the stomach. 2. Hydrocarbon exposure. And 3. Toxicology. A. Postmortem, basic liver tissue, none detected. Toxicology. Postmortem, basic liver tissue, none detected. B. Hydrocarbon and oxygenated volatiles panel, chest cavity blood. Then it lists the compounds again that were found. Then going down to opinion. Based on the history provided and the autopsy findings, the cause of death is asphyxiation due to smothering. The toxicology results likely represent decomposition and an artifact of being submerged in an oil tank for several days. The manner of death is homicide. So they're saying there that the positive findings are likely resulted from the decomposition and the artifact of being submerged in the tank. So a combination of those two. And obviously they had a lot more in their bodies because of the manner of which they were discarded, quite frankly. History. The decedent is a 4-year-old Caucasian female, date of birth December 17th, 2013, who has an unknown medical history at the time of this autopsy. Reportedly, the decedent was reported missing with her sibling and mother on the afternoon of August 13th. Unfortunately, the decedent was subsequently located in an obvious state of death within an oil tank battery container on rural property. The decedent was pronounced dead at the scene at 5:50 p.m. on August 16th. Witnesses. Personnel present for the post-mortem examination include Michael Burson, MD, PhD, pathologist, and Joey Weiner, autopsy assistant. For a complete list of individuals present at the autopsy, please see the investigative report file held at the Weld County Coroner's Office. District Attorney disclaimer. At 10:10 a.m. on August 17th, the representative from the District Attorney's Office read a portion of an email which he received from the Public Defender's Office. In this email, the Public Defender has requested that we swab the necks of the children for residual trace DNA. According to him and his expert DNA witness, they anticipate trace DNA being preserved on the neck structures of the children despite being confined in a container of oil, water, and associated sludge matter over the course of 4 days. Identification by the Weld County Coroner, State of Colorado. Clothing. The decedent is received in an unsealed body bag, wrapped in a bed sheet from retrieval process, and clad in the following clothing items: an oil-soaked pink pajama-type top with images of hearts and butterflies, a pair of oil-soaked underwear. Identifying marks and scars, none visualized. Evidence of medical surgical intervention, none. Evidence of injury. External evidence of injury. A 13 by 3 centimeter area of vertical excoriations on the left buttocks, and at least 1.5 centimeter laceration of the frenulum and upper gum line with associated pink-purple contusions. Superficial probable bite wounds of the mucosal surface of the tongue. A 9 by up to 4 centimeter yellow-tan possible abrasion on the left torso. A 3 by 1.5 centimeter faint yellow-tan discoloration on the superior aspect of the left shoulder. So you don't really hear of the torso or shoulder possible abrasions and discolorations. That certainly may have been caused when she was put in the tank. Internal evidence of injury, none. General external examination. The autopsy is commenced at 1:30 p.m. on August 17 on the body of Bella Watts at the McKee Medical Center in Loveland, Colorado. This autopsy is performed at the request of the Weld County Coroner, State of Colorado. The body is that of a well-developed, well-nourished Caucasian female whose appearance is generally consistent with the reported age of 4 years. The body measures approximately 41 inches long and weighs 38 pounds. At the time of autopsy, rigor mortis is released in the major muscle groups and the muscles of mastication. Liver mortis is not readily apparent due to postmortem artifact, in parentheses, decomposition. There is postmortem artifact consisting of bloating, marbling of the abdominal surfaces, and areas of skin slippage. Unfortunately, the body was found in an oil tanker containing oil and aqueous fluid. This resulted in abundant skin slippage upon washing. Head. Head hair is blonde-brown, normally distributed and measured up to 15 centimeters long over the crown. Eyes. The eyes are moderately opacified, in parentheses, postmortem artifact. The irides appear brown. The pupils are equal at 0.3 centimeters. The sclerae are dull. However, there are no discernible scleral or conjunctival petechia. Nose. The nose is midline and does not grate upon palpation. Oral cavity. The oral cavity contains natural dentition in good repair. The frenulum is markedly disrupted, and there are adjacent pink-purple bruises of the buccal mucosa present. There are also teeth impressions and superficial bite marks on the mucosal surface of the tongue. Neck. The neck structures are midline and without palpable adenopathy. Chest. The breasts and nipples are normal female. Abdomen. The abdomen is mildly protuberant and slightly tense, in parentheses, postmortem artifact. Genitalia. The external genitalia are normal female. Extremities. Upper extremities. The upper extremities are well developed and symmetrical with all digits present. The fingernails are short, dirty, and in fair repair without evidence of tearing. The fingernails are clipped and retained as evidence. Lower extremities. The lower extremities are well developed and symmetrical with all digits present. The toenails are short, dirty, and in fair repair. Back and sacrum. The back and sacrum are unremarkable. General internal examination. The body is opened with a routine thoraco-abdominal incision. The subcutaneous fat measures 1.2 centimeters in thickness at the level of the umbilicus. Body cavities. There are no abnormal fluid accumulations or adhesions in any of the body cavities. Cardiovascular system. The heart weighs 80 grams. The epicardial surface is unremarkable. The coronary ostia are patent. The coronary arteries follow a right dominant distribution. Sectioning reveals no significant narrowing by atherosclerosis. There is no acute thrombosis. The endocardial surface and papillary muscles are unremarkable. The myocardium is red-brown, firm, and without fibrosis. The valve leaflets are thin and pliant. Aorta. The aorta has a normal smooth yellow intimal surface. There is minimal atherosclerotic streaking noted. The major branches, including the celiac, superior and inferior mesenteric, and renal arteries, are widely patent. The inferior vena cava is unremarkable. Spleen. The spleen is soft and weighs 60 grams. The capsule is intact, smooth, and glistening. The parenchyma is firm, red-purple, and smooth. There are no infarcts, nodules, scars, or cysts present. Liver and biliary system. Liver. The liver weighs 350 grams. The capsule is intact. The parenchyma is firm and red-brown. No masses are detected. Gallbladder. A thin-walled gallbladder is empty. Gastrointestinal tract. Esophagus. The esophagus has a uniform diameter and intact mucosa. Gastrointestinal tract. Esophagus. The esophagus has a uniform diameter and intact mucosa. Stomach. The stomach contains approximately 75 milliliters of viscous green-black fluid, which is suggestive of oil and particulate matter from the oil tank which she was in. The mucosa is smooth, glistening, and arranged in normal rugal folds. There are no gastric or duodenal ulcers. Small and large intestines. The small and large intestines have a uniform dimension and appear unremarkable. The vermiform appendix is present. Pancreas. The pancreas is tan orange with lobular architecture. There is no evidence of hemorrhage or saponification. Adrenal glands. The adrenal glands have a golden cortex and gray-brown medulla. Genitourinary system. Kidneys. The right and left kidneys weigh 50 grams each. The capsules strip with ease. The external cortical surface is red-purple and smooth. The cortices are well delineated from the medullary pyramids. The pelvis and ureters are non-dilated. Urinary bladder. The urinary bladder is empty. The mucosal surface is tan pink, moist, and smooth. Female internal genitalia. The cervix, uterus, fallopian tubes, and ovaries are unremarkable. Neck. The anterior musculature is smooth and glistening. The epiglottis and hypopharynx are unremarkable. The hyoid bone and thyroid cartilage are intact. The laryngeal mucosa is pink-purple, moist, and smooth. There are no masses or aspirated material. The thyroid gland has symmetrical lobes and appears unremarkable. Spine. The spine has normal configuration. Skull and brain. Reflection of the scalp reveals patchy areas of likely tardieu spots. These areas are incised to reveal superficial blood collections within the facial planes. There do not appear to be any contusions present. The skull is intact and without fracture. The dura is intact and without epidural or subdural hemorrhage. There is no subarachnoid hemorrhage. The brain is moderately edematous with flattening of the gyri and narrowing of the sulci and weighs 1,300 grams. The cerebrovascular system has normal configuration. The cranial nerves are symmetrically intact. Serial coronal sections through the brain reveal no areas of hemorrhage, contusion, or mass lesion within the cortex, white matter, brainstem, or cerebellum. The atlanto-occipital joint is intact. The cervical spinal column has normal mobility. Specimens obtained. Specimens. Specimens retained at the time of autopsy include vitreous fluid and blood collected from the peripheral veins, heart, and lungs. Toxicology. Pooled blood as described above and liver are submitted to NMS Labs for analysis. Histology. Sections of heart, lung, liver, kidney, and brain are submitted for histology. Evidence. Swabs of face prior to washing. Swabs of anterior neck prior to washing. Swabs of face after washing. Swabs of anterior neck after washing. Swabs of bilateral hands, palmar surface. Oral swabs, vaginal swabs, bilateral fingernail clippings, deoxyribonucleic acid blood spot card. Radiographs, X-rays. Full-body X-rays are taken and submitted to the Weld County Coroner's Office. Microscopic examination. And then for the following organs, it says the same following line. Sections of the organ are without histopathological abnormality. It lists the heart, lung, liver, kidney, and brain. So that's where we'll end part 40, and I just want to thank everyone for your patience, as it's been a little more difficult recently to get these out, but I do expect to be able to get some more out in the coming days. So I'm no medical expert, so I can't comment a lot on these reports. Of course, we can say that Bella obviously had things in her stomach related to being left in those tanks for days. It's just absolutely sickening. And I think all I can say is sorry to you, Bella, and to the family for this to have happened, for these people to have had to go through these, examinations with little children like this. It's just awful. It's absolutely awful. In loving memory of Shanann, Bella, Celeste, and Nico, and God, please bless the Rusek family. This is The Diplomat. Have a great day.